Hi, this is Dr. Jim Anderson from Anderson Podiatry Center, here to talk to you about a very common affliction called a neuroma. It's actually one of the top 3 problems that we see, really common for you to have and for us to treat. And simply what a neuroma is an enlargement or an inflammation of a nerve in the ball of the foot. And it's typically going to be, and here's a skeleton as you can see, between the 2nd and 3rd toes, or 3rd and 4th toes. Very rarely over between 4 and 5 or 1 and 2. But again, 2nd and 3rd or 3rd and 4th. And it's really something that's in the ball of your foot. It hurts in the ball of the foot. You're going to present with pain in the ball of your foot. And sometimes a really common complaint is patients feel like they're walking on a sock. They take their sock off, their shoe off, and there's something in their shoe. It's not in the sock, there's nothing there. But they think they're walking on something because it can become kind of swollen. You may experience some numbness, some burning, some tingling. You may get some shooting sensations going out towards those toes. But that's one important thing, is it's very localized to this area or that area, okay? And patients come in and we treat. Oftentimes what we do as doctors would be, we would use orthotics, which are like custom-made inserts that go in your shoes. And basically all an orthotic does is it helps stabilize these bones and the ligament that is rubbing against the nerve. We all are built with a ligament that runs across the ball of the foot here, and the nerve passes beneath that ligament. So the nerve is located between the ligament and the skin. And we think that the bones moving side to side with the ligament being attached to those bones is what rubs against the nerve. And so by holding the bones of the foot and the ligament in a more stable fashion with an insert in the shoe called an orthotic, that reduces the rubbing and irritation, and most of the time that works. We sometimes will use cortisone injections. I'm not a big fan of it. It can work permanently, but not oftentimes will it. And then of course there's surgery. If you ever had to have a surgery, it's done in our surgical center. It takes about 20 minutes. And typically I go in, I do not usually remove the nerve, but rather that ligament that I mentioned that irritates it, I make a little incision and cut that ligament so that it's not rubbing against the nerve. It's very much like doing carpal tunnel surgery. You can walk right away and you're just in a surgical shoe like this for about 2 weeks. And success rate's pretty high with that. So very common problem. Things that you can do, you can think about if it's not very bad. I mean, you could try to wear wider shoes, or maybe wear a shoe that's got a little bit softer sole. Those are some things that you can do. But if this is going on for 3 or 4 weeks, that's a good time to give us a call, because it's getting to be a little bit more difficult for you to treat, and I think it's time that maybe we look at your foot. So if this is something that's bothering you, please give us a call and go to our website at AndersonPodiatryCenter.com. Thank you.